Good morning, afternoon, and evening to this post-BRT 2020 video conference, the Trauma Team Training Review Session. So, let's get going. Let's just remember the Trauma Team course goals. First of all, it's designated for under-resourced centers. We want to create trauma teams in the emergency departments. We want to develop understanding among the members of the team where they respect each other's roles and participation in the care of the trauma patient. And finally, and most importantly, we want to ensure quality care for all trauma patients. The objectives of this video conference are to initiate a process to update the trauma team course. I don't expect that we will have the entire course redone in this few-hour video conference, but I'm hoping we initiate the process. We will be definitely looking at the lectures, the skills, and the team exercises today. First of all, let's look at the lectures. We want to determine the content. We need to upgrade pediatrics. We need to remove any outdated information and any errors. We need to improve the design and upgrade the slides with insertions, animations, videos, and make them interactive. PowerPoint is much more than it used to be. We have access to the VBA code. We can recode it. We can make it very interactive. Or we have to consider, do we want to put the PowerPoint lectures on another platform, mobile or tablet based? Can be very interactive, but is very expensive. At the 2019 Bethune Roundtable, we had a post-conference trauma team training instructors course. And Rajan Bola made a survey of the participants on their opinions about the course. They made certain recommendations, which I'd like to add to my own recommendations. Some of them are similar. They think the slides should be updated, improve interaction and transitions and animations. They thought the slides should be simplified. Some are too complex for community health workers. The images should be improved, more color, better resolution, and anatomic visualization. We need to consider cross-cultural implications, in particular around medications and dosages. And we need to translate them into French. Back to my thoughts. The skill sessions. We need to evaluate the protocols around ABC or the alternatives, around types of transfusion protocols. Do some of the more aggressive protocols make sense in the under-resourced centers? Skills. For example, venous access. Is central line appropriate? Should cut down be maintained? Models. Chest tube. Biological versus artificial material. Supplementary apps. We have one. The Kampala Trauma Score is available on app. What about in Edmonton? What did the survey show there? Well, they wanted to include additional trauma techniques based on current practice and best evidence. That sounds perfect. I'd like to know exactly what that means, and maybe some of the participants can tell me what they're thinking about, or you can make suggestions as well. They were also actually very prophetic when they suggested that hazardous material exposure protocols may need to be fully implemented or standardized within the trauma team training course. The team exercises. I think we need to review them. Look at the scenarios, the details, the equipment, what clinical equipment should be available, what clinical equipment is not appropriate for the under-resourced settings. Do we have drama material, blood, wounds, simulators? I'm not sure. The team exercises could be done digitally with avatars, but this is very expensive programming. The evaluation system we use, is it successful or appropriate? What about in Edmonton? The team exercises. Actually, the participants liked the team exercises and didn't have a lot of suggestions. They felt that the role playing gave them insight in how trauma is dealt with in settings where no doctors are present. They were able to work through the trauma scenarios from beginning to end as appropriate means of learning critical skills, and they felt the participants understood that teamwork is a key to skill based on these exercises. The outcome of this workshop. I would like to see a working group, volunteers to be involved in the lectures, the skills, the team exercises, developers, PowerPoint developers, VBA coders, all of these would be helpful. Future plans. Can we have a follow-up meeting? Would we be ready with new material to discuss in August? Funding sources. Unitar. We'll hear about that later. AO. Piloting. When we use new material, we need to try it out. Are you willing to try it out in your country? Thanks very much. I look forward to a good session and a new beginning in the assessment of trauma team training.